Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. This week we're going to be talking to you about conservative treatment options for low back disc herniations. If you have a disc herniation, a disc protrusion, or a disc bulge, you're definitely going to want to stay tuned. There's a lot of different treatment options that don't include long-term pain prescription medication or surgical intervention. It's going to be some great information, so stay tuned. Okay, Dr. Mike, I've said this before, oftentimes conditions coming into the practice seem to be contagious. So we've seen a string of patients that have come in with either lower back or cervical disc injuries, and there's a lot of concern that they're going to be on long-term pain medication management or they're going to go rush in for surgery. We have a lot of different treatment options here in our practice. And the other concern is that a lot of the patients, like two yesterday, are really young. I had a 27-year-old and a 21-year-old, both with pretty substantial lower back disc herniations. When it comes to the injury of the disc, oftentimes there's a lot of confusion between a disc bulge, a disc protrusion, a disc herniation, and then what can be done conservatively. We've got a definite advantage to help these patients out without the use of long-term meds or surgery, right?
Absolutely. The confusion really is based on the aspects of radiology, identifying this herniation, again, protrusion, as we mentioned. But realities are the disc has sometimes an injury in a sense there's an acute abrupt change.
Yeah.
And then there's recurrences or exacerbations, or people have tweaked their back, and so you can aggravate the disc that was already changed previously.
Yeah.
So we have to just make it simplistically. If we think that the disc is this nice strong structure, has a lot of ligament fibers on the outside, and there's a center nucleus. If the disc is bulging, there's really no content of the nucleus changing. It's just the disc is kind of bulging out. It's relatively normal for all of us going through some dynamics of changes, but the outside fibers are starting to break down a little bit. They get inflamed, they get aggravated, and they can cause pain.
Yep.
The protrusion is to think about a little bit of that disc material in the center pushing forward. It's like just like a little bubble, if you will, but nothing really is broke through, so that internal content is not really disrupted the outside fibers, and it really is protruding a little bit beyond where it's supposed to be in a center.
Yeah.
A herniation really says the center contents come out of position. Many people out there may have recognized the word hernia, that they've seen an umbilical hernia or an inguinal hernia in the groin because of something internally was supposed to be inside, protruded, actually extruded outside that content. So now there actually is an herniation. That's much more of a greater problem in the disc, and that could be much more symptomatic. But all areas of those discs, when they inflame, can cause pain.
Yeah.
And the duration of time for a disc process is several weeks at times.
Yeah.
So it's not uncommon when people feel like, oh, my back has gone out, it hurts terribly, and I just hurt it, and why isn't it getting better? Why isn't it getting better? It does take time, sometimes several weeks. But yet when we think about getting on early, treating with medications, you want to do that early and only early at the early stages of inflammation, and then we can implement some of our treatments as you mentioned. When we start mobilizing the body, getting the muscle to kind of get out of spasm, getting the chiropractic tables to get some expansion, decompression, and as you know, when you get in there with your hands, you can really kind of alleviate some of those pressures to get the body to settle down, and that alleviates the pressure pain, and so gets a person through where we don't need these medications to get you through. But this disc stuff hurts.
Yeah.
And we need to try to treat it aggressively early and get people away from the medicines and get them continuing to improve over 3, 4, 6 weeks times.
Right, and we really stress getting to the root cause of the problem. So, we've talked to you a bunch. We're a very holistic-minded practice. That doesn't mean that we never prescribe medications. So you got to understand, a lot of times these patients are coming in, they can't even get down on the table because of the level of pain. So a common prescription that you'll write is very short-term, an oral steroid that we call prednisone, right?
Prednisone, yes. So prednisone is an oral steroid, potent anti-inflammatory. So people may have heard of the NSAID, which is a non-steroidal anti-inflammatory. That's your ibuprofen products, your Aleve or naproxen. The steroidal anti-inflammatory is prednisone. So we usually use about a 6 or 7 day course, typically like a 6-day taper, and then you're on it and you're off of it. And that's what should get that acute inflammation down, and then we try to avoid the steroids thereafter.
Right, right. And from a chiropractic perspective, and our practice is positioned pretty uniquely where we combine medical care, physical therapy, and chiropractic treatment under one roof. On the chiropractic side, we're one of the few clinics that utilizes decompression. So the decompression therapy for disc injuries is a hot topic. A lot of clinics nationwide are using decompression. We have awesome response with decompression. We adopted that about 20 years ago in our clinic. And that's a very effective way to help reduce the size of the disc. So from a chiropractic perspective, if you have a disc bulge, as Dr. Marciello described, just some of the outer fibers of the annulus fibrosis are kind of pushing out. So for us chiropractors, that would be a condition where we could very easily do some gentle, traditional chiropractic adjusting techniques. When it comes to disc protrusion or disc herniation, where you start to get that movement of the nucleus pulposus out further, whether it's a protrusion or herniation, and usually there's some neurological deficit associated with it, with reflex strength or sensation, that's when we really want to use the special technique with decompression, where the patient is lying comfortably on their stomach, under the doctor's control, the table stretches out lengthwise, and then for those real severe cases, we have the option of extending that time. Patients are getting a great response with the auto decompression, where they're on the decompression for at least 20 minutes or so, and that helps to just open up the canal space. It creates a negative pressure that brings that disc back towards the midline. And again, really emphasizing to the patient too, it's going to take some time. So generally speaking, we're looking at treatment plans anywhere from about 8 to 12 weeks. You're not going to be in incredible pain for that period of time, but if you go through the appropriate treatment, the chiropractic care, the physical therapy, and then the medical follow-up, the goal is to make sure that, number one, we get you out of pain, but then number two, as I stressed to my 21 and 27-year-old patient last night, we want to make sure that it doesn't come back. And that's really where the hard work comes into play. And then more specifically, things that we can do, particularly for those younger patients, because we're not typically talking about those regenerative injections with those younger patients. However, if we do have an injury like that, where the disc pushes out, those vertebrae are getting closer together. And what happens is the movable joints in the back get really close together, and over time, they start to degenerate prematurely. That's a great time, as I explained last night to the two patients, where we could use a combination of either the Wharton's jelly allograft or with the PRP. In those two cases, those patients were young enough where we said, you know what, you probably bypass the Wharton's jelly, we could use the PRP injection for the long-term healing so that we get as close to full recovery as possible.
Yeah, absolutely. And the thought process also, we're talking disc and the joints of the spine, but the muscles that attach there where we're also treating. That's why some of our treatments, as you mentioned, take about 12 weeks. As I mentioned, 3 to 6 weeks is kind of the time frame of the inflammatory response, the actual healing properties of the disc. But that stops there. Now you have to do the hard work, as you mentioned, in that next month or 6 weeks time to get the body moving, get those muscles stronger, and that reduces the pain because you're also protecting the aspect of the injury in the first place. So getting that second half of the treatment program of that 6 weeks is really, really important, and that's what we don't want people to neglect. So that's why it's so important to think about that PRP, the physical therapy, and the treatments where you're restoring that muscle memory and movement problem.
Right, exactly. And we're in such a great position to help these patients because we combine all the services. And other things that we can do, we can prescribe a lower back support, a cervical traction unit. We can do very conservative intramuscular injections where we use a natural product to relax the muscles, to make it easier for the chiropractors to stretch the spine. Certainly makes it easier for physical therapy to really focus on core stabilization. And we want to make sure that you're aware that there are all of these conservative options that really help to make sure that you're taken care of, not just for the short term, but for the long term as well. If you know somebody or you yourself are suffering from pain due to a lower back or cervical disc injury, you're definitely going to want to call our practice. We take most insurances. A lot of information can be found on our website specifically about decompression therapy. You want to check out a couple of those videos. Wealth of information is always found too on our YouTube channel. We've collected about 2 years of patient education videos, and we definitely recommend subscribing to that channel so that you get all of the updates. Well, that's it for today. I hope you learned something. We'll talk with you soon.
Bye now.